people really underestimate how much traumatic brain injury and the lack there is of quality of life through function and being able to do things for yourself. They're like, oh, if I ever have to wipe my ass and, cut the cord, let me loose. You always hear that from people.
Mhm.
And so that's why we talk about these topics, because we care about, and we do get spicy because someone's life really depends on it. And it's not cool to see some influencer online trying to sell you a breathing app that's going to solve your life problems when you're on the borderline of suicidal ideation. Like, not cool. And so that I will get spicy for.
Welcome to the Concussion Nerds podcast, where we dive headfirst into the world of cutting-edge concussion care. I'm your host, physical therapist Natasha Wilch. This show is for all you incredible clinicians out there who are passionate about revolutionizing the way we approach concussions. You're craving that sweet balance between scientific expertise and compassionate care, and that's exactly what we'll be serving up on this podcast. If you're ready to break new ground, be in high demand, and transform the lives of your concussion clients from feeling stuck to absolutely excelling, then you're in the right place. So whether you're an experienced clinician looking to refine your craft or a fresh-faced newcomer eager to make your mark, this podcast is your ultimate resource. Grab your headphones, hit that play button, and let's dive deep into the incredible world of concussion care. Before we get too deep in today's episode, I just want to introduce you to our sponsor, Jane App, clinic management software and EMR system that I have been using in my clinic for the last 9 years, and I cannot imagine using anything else. The team at Jane understands that clocking out from the clinic doesn't always mean you're clocking out for the day, and instead it's often the start of charting long into the evening, which none of us like. But with time-saving features like charting features, custom smart narratives, chart duplication, dictation, Jane helps us finish our charting with our patients or our client notes during our work hours, not after, so that you can go home and be with your family or do your activities or whatever it is you want to do and not finishing those long notes. To save you even more time, you have access to Jane's chart template library that is fully stocked with pre-made templates that have been generously shared by practitioners in the community, and you can even customize them further with your own charting tools, photos, checkboxes, range scales. To see how Jane can help you free up your evenings from admin tasks, head to the show notes to this link below to book a personalized demo. But if you know this is what you're looking for and you're ready to get started, you can use our code SYMPHONY1MO, it's below as well, at the time of sign up for a 1-month grace period applied to your new account. Thank you, Jane App, for being a fundamental tool in my clinic at Symphony for the last 9 years. Hello, friends, and welcome to another episode of the Concussion Nerds podcast. I am stoked today because we are joined by my colleague and friend, Dr. Michelle Eisenmann. Welcome, Michelle.
Hi.
I'm really excited to have you here. So Michelle and I literally just started having a conversation, and I was like, you know what? Let's just record this. So Michelle is a chiropractic neurologist, functional neurologist. What title do you call yourself?
That's
Both
a
of
good
those?
one. I
Right?
mean, I guess it depends on the day and who I'm talking to. So, really seriously, I will sometimes introduce myself as a chiropractor. Sometimes I'll introduce myself as a functional neurologist. And then other people that know a lot about both, I'll say chiropractic neurologist, just because that kind of lets them know what I do within the functional neurology world.
Yep.
So it depends on who I'm talking to and what kind of information they're looking for. But
Okay. So for those of you all listening here, Michelle works with concussion in the most beautiful way that you all know I love, in a very integrated fashion. And so when you look at her clinic's reels, which is Resiliency Brain Health in Coppell, did I say it right?
perfect.
Yes, Coppell, Texas. If you look at the reels that she posts on Instagram for her concussion treatments, and if you look at the reels that I post on Instagram for my concussion treatments, you will see some similarimes.
I
Both in
know.
terms
I
of
geeked out the other day. I saw your NSI.
yeah,
I was like, hey.
right. It's like, oh, I was like, oh, that she's using that module. Oh, I haven't used that one in a while.
Yeah, same.
Yeah, it's fun to geek out on, well, all of it really, in the tech and that piece of things. And so Michelle and I were talking a little earlier because she's getting a little spicy on her social media. Like the vibe is there. I felt it in general, but I felt it from you. And I was saying, like, I'm feeling that desire and almost that need to step up and be a little bit more bold and a little bit more vocal on mine as well. So, Michelle, I mean, you're always a fiery person. You're a brilliant woman, but like, where is this current, like, extra hot sauce come from?
So, well, we already talked about part of this, but I'm going to reiterate that
Yeah.
and add something to that because
Please do.
I think there's a lot of people online too that are becoming very vocal. And, I don't know if you allow cuss words on here, but they do,
Yes.
like, I see a lot of people selling a lot of bullshit with confidence. And so, in taking advantage of a population that is desperate for answers, and I have two big perspectives. I have the veteran community that I am very intimately involved with. I'm kind of spicy on that end because a lot has changed in my life since you and I met. I mean, I call you my Canadian pen pal at
I
the
love it.
clinic. I'm not going to lie to you, like Jay, which works at the clinic, he's actually like co-owner with my other boss, Dr. Gode. Like he always says like, "Oh yeah, it's Natasha, your friend." So you're known. Yeah. So he's like, "Yeah, I got a invite that you're going to do a podcast with Natasha." And I was like, "Oh, how did you know that?" But a lot has changed in my life,
Mhm.
like I've been able to be blessed to have a home and have a child and have like other things get more degrees. And however, my veterans continue to say the exact same story on repeat, and nothing has changed in these past like 5 almost and a half years, like going on 6, for their stories as when they come back from like the VA and how they're treated when it comes to their traumatic brain injuries.
Mhm.
There's a lot of awareness when it comes to PTSD, and that's fine. But why does the conversation have to stop there? Why can't it continue on to the other things that we very well know? And I think a lot of it has to do because there's not a lot of financial gain to be made for certain people in certain companies when it comes to the kind of work that you and I do, because
Mhm.
it truly does require, a service and an act of love to
Yes.
like work with people. Like you cannot replace this like one-to-one service. And as much as we do and we try to bring richness online, which can be done, and it can, I mean, you're doing an excellent job at that. There is something to say about like someone working one-on-one with a person, and you still even do that because
Oh,
it
yeah.
requires that kind of level of attention and collaboration, as you said, with other people.
Yeah.
It's really hard to make a financial gain from that.
Yeah, and I think
Um,
to that point for a second too, and I love that you brought that too, is like there is a place, I believe, for the one to many model, basically the online model of what I do, right? So in terms of people on a healing journey, as I have my concussion mini school, which is a one to many offer, but it's also I think recognizing what is the purpose of the offer you're offering and then how do they complement together, right? So mini school being the one to many is very much an education, a place to ask questions of someone who actually understands what the fuck they're talking about and find community to then guide you to the one-to-one rehab. I am similar to you in that I don't think virtual, obviously, I've been in the virtual space for many years. I
yeah.
think virtual 100% has its place, and you can't replace what we do in clinic online.
Absolutely. Like, I'm 100% with you on that. Like, we do a poor job. We're still working on it. We have some stuff online as well, but we purely use it for education too. And that's great. I mean, like, it's a great thing that you can go in the comfort of your home when you just can't be outside and do all these things and learn, but it will never replace a one-to-one. And I do see other individuals trying to do that, trying to replace that one-to-one, which is not cool, or selling things and misconstruing different buzzwords, because I
Mhm.
feel like in the civilian community, now that I'm switching from the veteran community, there's like both of these TBI communities are going through very different things right now. So
Okay.
in the veteran community, It's that whole struggle of even recognizing that they've had a traumatic brain injury and being able to have care for their traumatic brain injury in order to also have some of those overlapping symptoms with PTSD to resolve. And in the civilian community, I see these buzzwords now. Before for you and I, it was like, wow, we've learned of these things. How can we help educate people that this even exists? And how can we take people from, hey, maybe you don't have fibromyalgia, maybe you have an unhealed concussion that you need to work on, and you look at functional deficiencies, but now dysautonomia is a buzzword, FND is a buzzword, even concussion in itself is starting to become a buzzword. And there are things being said online, or, my biggest pet peeve, and I'm just going to be super honest,
What?
if you have
Love it.
a
I'll share mine
problem with it,
after.
I guess DM me. And I've had people disagree with me on DMs before, and then we ended up being friends.
Disagreement can be approached with respect and kindness with a
Yeah.
potential to see another viewpoint. That's how I look at it. So fire away, my dear.
Yeah. Like, so a lot of people are getting, the dysautonomia umbrella, and it's a very fancy word. There's dysfunction in the autonomic nervous system. Part of this is normal day-to-day life activity. You can have dysfunction in that system from so many different things.
This
And
was last
true,
week's podcast episode, but keep going.
yeah, true dysautonomia, POTS, orthostatic hypotension, like looking at all of these bigger issues or more severe chronic type issues are now being labeled
Mhm.
with other things. It's typically associated with something else. And, you know, I think we saw a video of this very kind person that's trying to spread awareness, saying that their FND symptoms were caused by their POTS. And it's not to say that you can't have both of them at the same time, but I feel like that makes people very confused as to, like, well, now I have POTS and now I have FND. And I look through social media and I see these people with these accounts that have now labeled themselves with concussion, POTS, EDS, mast cell syndrome, like zebra, I don't know. And so they have all these different diagnoses.
Which is such a dangerous road to take yourself down.
Yeah, it's so dangerous. Not only can you, one, be taken advantage of from a provider, because, like, there are providers that take an oath, but they don't mean it. I was a victim to that.
Okay.
Yeah. Yeah, I was a victim to that. Like, before I got my doctorate, I was labeled with PCOS. I was labeled with dysautonomia. I clearly had had a concussion, which I didn't really even know I had, because I got fooled into doing diagnostic testing. That's for another day. But yeah, and I was like, whoa, that's me. But I got labeled with all of these things, and I saw many providers. Honestly, I'm a chiropractor. I love chiropractic, but I saw chiropractors that was super shitty. And he charged me a buttload of money to do some adjustments that were not the root cause of what I was struggling with. And although it did help some pain, he didn't ever do his due diligence of helping me with other things. I saw a functional medicine practitioner that put me on, I'm not even kidding you, like 15 different supplements. Like, some of them were good. I was a student at the time. I couldn't afford to do all of that.
Dollars.
Yeah.
Yeah.
And, like, not cheap supplements. We're talking about Apex. We're talking about pure encapsulations. We're talking about, like, the high end stuff.
Mhm.
So if you know, you know. So love those. Nothing wrong with them. But 15, come on. And not taking into consideration that I was a student and just fixing my PCOS, fixing all these other things without addressing everything or collaborating with other people and really understanding what to do. I think the same thing is happening in the online space for people selling programs for breath work just to cure dysautonomia. And although I do believe breath work is so important for dysautonomia, the messaging has to be very clear, because whoever you're speaking to may think that's like their one and only thing. That's their one and only
Mhm.
cause to do. Same thing with epigenetics. I have some people that I know that are just going down the rabbit hole of MTHFR, which is fantastic. That's good to know, need to know. But now you don't just have MTHFR and you have POTS and you have this and you have that. Like, all of that is feeding each other
Mhm.
and finding practitioners that know how to work every angle with collaboration is
Well, and I think,
important.
and this is one of like my biggest pet peeves in the space too. So it's that piece. So literally last week's podcast was like off our like conversation because I was like, a dysregulated nervous system is not dysautonomia. Is there a
Yes.
dysregulated nervous system within dysautonomia? Yes. Is it the same thing? No. I can be dysregulated. I sure as fuck was. I did not never have had dysautonomia. Right. And so again, the Instagram things that are driving me nuts now that you're seeing, and it's dangerous because it's mixed messaging, exactly like you said, and it's painting a picture that isn't accurate as well. And then when things don't work, it crushes hope. And we know that that is such a instrumental piece in this healing journey when you've been on it for years, right? And so the Instagram ones that are driving me nuts is like, it wasn't IBS, it was a dysregulated nervous system.
Oh my God, yeah.
It wasn't depression, it was a dysregulated nervous system. And I'm just like, it
Yeah,
is
that seems
one,
to be a huge buzzword now.
it is a huge buzzword right now. And yes, I have a workbook about helping you reconnect to your nervous system and work on nervous system dysregulation. I believe in it. I think it's important. I think everyone in the fucking population needs to understand it. It is not the root cause of every medical problem out there.
Yeah.
And so I think like
Sure as hell aiding to it, but it's not.
totally. And it's that piece of that element of, I think, same as you, like why I've started to feel a bit more comfortable getting vocal because absolutely there was a period where I was like, I don't want to say what I'm really thinking because I don't want to piss people off. Or like, I don't want to say what this is going to sound really bad, but like we're in a very male dominated field.
Yeah.
And like, I don't want to say something because what if it's not received well? And now I'm just like, this is what I think. This is what I believe. This is what I see. And like you see in your clinic over and over and over and over again. These are the stories we hear over and over and over again. And I'm done.
Yeah.
Um, and that piece too. And the so much. So where Michelle, for those listening, like where Michelle and I are different is, so I call it an integrated model, which is
Mhm.
like two, right? So we have the ability when you come and see us in our clinics that we're not saying we treat everything. We're not saying we're experts in everything. We absolutely have networks of professionals in multiple disciplines that we will collaborate with and refer to. But when I'm also talking, and you hear me talk a lot about a concussion literate provider, what I'm
Yes.
talking about is someone like Michelle, is someone like myself, is someone like some of the other guests you've heard. It's someone who has that ability to assess the multi domains of your system as a whole to find that root driver to then build an integrated treatment plan. Because what we see on the PT side of things, so on the physical therapy side of things, is care is siloed. As in, they see the orthophysio for the neck and they do some manual therapy and or chiro for adjustments. They'll see the vestibular therapist for the vestibular side. They'll see a neurooptometrist for the neurooptometry side. You know what I mean? But like
Yeah.
every single one of those professions is great. And yes, we might have to collaborate. But if you don't have that pivot person who understands how it all comes together, then I guarantee you you're spending more money and time on your rehab than you want to be.
Yes. It's funny that you say this because I do have a patient right now that, I always say like I'm bad for business because I really am. Because, this person had really, really severely low cholesterol. And so we know that cholesterol is very important for synaptogenesis. And so one of the things that they were working on is they had accidentally been taking some cholesterol lowering supplements already,
Okay.
like and blood pressure lowering supplements as it is. They already had a super low cholesterol and they were struggling with a lot of dizziness and balance issues. And so I created a very short treatment plan to see if we can get the nervous system or the brain to recognize the necessity for increased blood pressure and to be able to start mitigating some vestibular issues. But that's, I cut that right there. And now we're in a situation that we're doing homework and I'm not having this individual come back in and do more unnecessary treatment and therapy and having her co-manage with her other functional providers to be able to reestablish that cholesterol to come up, to be able to do some of the things that I'm telling her to do at home, to come up. And we did do vestibular therapy, we did do some chiropractic, and we did see improvement on some of those things. But for it to be like a long-term lifestyle, like lifelong solution, it's not for her to live at the clinic 24/7 for me to do therapies nonstop. It's at that point, like you said, a concussion or like a brain literate person to be able to say, okay, my time with you is not like you're going to not spend the best bang for your buck right now. This is what you need to shift gears on right now. Maybe you come back, and I do have this person set up to come back in a month or two to do some diagnostic testing just for this person's own peace of mind to know that they
Yeah.
are improving. But at this time right now, they're working a lot more with other functional providers and just kind of co-managing in that way. And, it's very important. And we have a nurse practitioner, we have a functional movement trainer as well. And we are kind of in the works of working with other mental health providers, but it's so pivotal too, because not everyone starts off the same.
No. Mm-mm.
For us, like maybe one individual desperately needs to work more with that functional medicine provider before they can even like think about seeing us.
Mm-hmm.
We have had people have to work with us before even having to think about going over there. And so just like the brain is so unique with its individual gyri and, the formation of it. If you've ever done brain dissection, like every brain is different.
Mm-hmm.
Like literally, which is
Literally.
beautiful. It's beautiful. It's wonderful because it just showcases individuality, which is why it's so hard to do concussion research.
Yeah.
But that's how it should be per individual. And everyone wants this like quick fix, or providers are not like catch on to that. And they're like, well, if you do this for X amount of weeks, like you're going to be healed forever. And that just isn't true.
Mm-hmm.
So,
And I think you hit on a really important topic too that I think we commonly don't give enough thought to, is that your services might desperately be needed in the picture, but it's not the right time.
yes.
Right. And you hit on that so beautifully, because it's not to say that vestibular rehab isn't implemented. It's not to say that oculomotor rehab isn't implemented. But if you don't have the fundamental capacity to bring that into your life, if you're working through many other things, like if there's so many factors, and again, every single person is different.
Mm-hmm.
It's that ability as a clinician to also be able to recognize and say to that person, yes, you have like my services are necessary. However, here's what we need to do first and why.
Mm-hmm.
And so for us, like in circumstances of my clinic, that's come into play a lot with trauma.
Mm-hmm.
Right. And so people who just in terms of where their nervous system is at, even though we just talked about that, but an element of like a very significant trauma history that will significantly impact our ability to do our job because of what the triggers are and because of what the traumatic event was and because of what that trauma is having and the impact that's having on the body and the brain and the nervous system, that sometimes that needs to be addressed first. And not to say, and I'm never to say that it needs to be fully resolved, but there needs to be foundational work done there first before I can do my part. Right?
Absolutely. Like 100%. And we have seen people too that we've had to, for mental health purposes, had to refer them to do something else before coming to us, because the kind of work that we do with people and the kind of work that is required for neurological wellness is life-changing only because you have to change your life. Like you cannot continue to live in the way that you were living. And so these are choices that have to be made, which we go back to, it's not easy to make financial gain out of this because it actually requires someone to change something about themselves. And we've done that in terms of metabolics. Like, metabolically, definitely needed to do that before seeing us. You name it. I mean, we have had literally all of it. Strength, too. We co-manage stroke patient with a PT and another funk neuro. And so it's wonderful. Like we work on some of the motor coordination parts of it and some vestibular work. And they work a lot on strengthening on their side because he has a home gym and he's great. And it's wonderful because we have been able to integrate because they know a lot about vestibular work too. Like what we bring to the table, they bring to the table, and then the other things they do. But that is so important. And everyone kind of thinks like, oh, I had a concussion. So like I must do vision therapy and I have to do this therapy and I've done all this therapy. And it's very segmented.
Yes. Huh?
And I'm sure this is what your
This is what my
probably
program,
clinic.
yeah, like in terms of both, like that's what we try to eliminate in the clinic and in my concussion nurse program, so my mentorship program for clinicians, like this is what I'm trying to eliminate is this segmented approach. It's like, how do we teach you an integrated approach for a whole picture to then be able to go from there so that basically the segmentation disappears because it doesn't work.
And I'm sure this happens to you in your clinic too. Like
Oh yeah.
we have to like I talk a lot more about the veterans, civilians because they're not grouped. They're definitely like so different plan to plan. So it's hard to use them as a picture. But with the veterans do come 2 weeks at a time because we want them to have a battle buddy to go through it with. And so really that's the reason we do that. And ironically, most of them have served together. And I'm like, oh, okay, that's cool. But like our treatment plans are very dynamic.
Mhm.
Like I may write this whole treatment plan and
And
then
then it
the
changes when you
day
throw it out the
one,
window.
yep, and then I have to "Whoop, actually
Yeah,
your
there isn't
VOR
too like,
sucks. Let's do this instead.
yeah, like I always say the assessment gives us our starting point. And so our assessment gives us the like, hey, here's we know this is our route and we have an initial plan. And then you go to try it and you're like, oh shit, this isn't gonna work. Or it's like you go to
Yes,
implement it and like something else creeps in, like then something else becomes more apparent and you're like, this is whole plans down the toilet and you're starting from scratch. But then
literally.
also in these clinic models, this is my big pet peeve too. So in your clinic and my clinic, my client works with me.
Hmm.
Your client works with you.
Yes.
I really struggle with the clinic models that pass that rehab off to a rehab assistant
Hmm.
because the rehab assistant isn't trained. Like you have trained them within your little bit, but like they don't know what to look for the same way you do. They don't know how to like shift your treatment plan by this much to make a shift or a change. Like that's where I struggle with some of the like old school and you could say, so I guess new school models. Like there's places you can pull assistance into play for sure.
Yeah. Yeah.
I
Like if we have a rebuilder that needs to be filled or if they just need to vibrate or something like that. Like,
exactly. But in terms
but
of the like the parts of your treatment plan that you are constantly tweaking, shifting, like to me, like that should never be transferred over to a rehab assistant. Like that should be us.
yeah, we do have one assistant, but they help with like setting up metronome. Like
Totally different. Like, and that sort of stuff, absolutely. Honestly, like if
exactly.
you want to have an assistant run your initial diagnostics so that you can
We
review the
yeah.
findings, like
Like
that
anything
sort of
that
piece.
kind of is like we don't need to waste time on that because we could be doing something else kind of thing.
Mhm.
We always do eye movements. We always do vestibular rehab. We always do gait. We always do, especially like some cognitive. So we have a lot of hands on.
Yeah.
Like we don't just take notes, do the initial assessment, and go to our rooms
No, you guys,
while they're,
you do the work. And I
yes,
think that
like,
like when I look at even in our space, when I look at the clients that because similar to you, like the most of the clients that come to me, and I'm guessing most of the clients come to you, they're the clients that have tried everything.
yes.
How
Yeah.
much do
Like,
I like
hey,
how much do I dream that people would come to me sooner? Like
yes.
so much so. Like come to me 6 weeks out, please.
Yes. I
Like
will say like that. Okay, that now that you mentioned that, this is just like a side note. But a lot of the times they'll come in and they'll say, like, this is the last thing I'm willing to try. And they're like, oh, you'll be seeing Dr. Eisenmann today. And I walk in and I'm just like this very short Latina. And like I don't look my age. I look very young. I look very little.
mhm.
Or so I've been told constantly. But that's my family. Like, I mean, no one looks their age. And so they're like, what am I gonna do?
What have I gotten into? I had someone walk in once. I was sitting at the front desk and they were like, I'm here to see Natasha. And I was like, that's me. And they were like, oh, you own the clinic? And I was like, yeah. They're like, aren't you a little young? I'm like, I got some decades on me. Don't worry.
Yeah, it's like we just take care of our brains so well that everything else
Right?
is
All the brain health. What was it? My aura ring said I'm chronologically 6 years younger than my actual age or something like that.
That's awesome.
I was like, yes.
That is awesome. Yeah, and it's the thing, like, take care of yourself and you'll look younger. But yeah, like, I do often get told, "Hey, this is, like, the last thing I'm willing to try," which is sad because even some functional providers now are starting to become very scammy. The amount of people that come in and have 7 different vibrant lab tests that have never been interpreted for them. And I look at them and I'm like, "Oh, well, the answer's right here. Like, did no one tell you this?" And they're like, no, they just ran the lab and they said some things were out of norm. And I'm like, and what was the treatment plan they gave you? And they're like, nothing. And I'm like, that's crazy. Like, I had a person that had an anti-gliadin response,
I don't even know what that is. Full transparency.
like a GAD autoimmunity. So he had cerebellar antibodies. And
Okay.
gluten is not the trigger, but gluten can set like it's not the root cause, but it can certainly trigger the gliadin response. And it was like right there in his paperwork. Yeah, and he totally looked like he had SCA, like he had some kind of cerebellar atrophy. The way he spoke sounded
Mm-hmm.
very much like an aphasia. He could not even stand like this. He had to stand like that to be able to
Okay.
balance. It was very, very bad. And one of the first things was like, "All right, so what do you do for food?" And he's like, "Not, I'm not avoiding anything." And I'm like, "You're not avoiding anything." His provider had never told him, "Hey, you have an anti-gliadin response that's literally eating away at your cerebellum. So if you're going to order labs, like know why you're ordering them and
Mm-hmm.
explain it to them." And he got those like 2 years prior. So yeah, and same with my cholesterol person, like they're like cholesterol was super low. No one told her, "Hey, by the way, you need cholesterol for synaptogenesis."
Well, and I think it comes back to that conversation of we say it in this is like if you've seen one chiropractor, you've seen one chiropractor. If you've seen
Yeah.
one physical therapist, you've seen one physical therapist. If you've seen one functional neurologist, you've seen one functional neurologist. Because we all have our different strengths, weaknesses, takes, lenses. And I find that too is like for me, it's like we tend to attract a certain type of client because of the strengths that we have. It's always sad to hear like this is my last hope, this is my last thing. Like I understand where it comes from. And for so many people, it's that piece of at least by the time they reach us, a lot of them like they've tried so many things. And then it's like the beautiful thing is
Yeah.
that then honestly, like they see change for the first time in years or months or whatever. And then that hope is reignited. It's so funny. One of my clients messaged me today. So she's coming back for another intensive, and it had been 4.5 years that she'd had really no change on certain things. And we got some really epic change in her first one. She hadn't been able to read, like actually read her book or a Kindle in like 4.5 years. And now she's reading for 20 minutes.
That's
Uh,
awesome.
but she was like, I'm appreciative of my abilities. She's like, and I just want more of them. I was like,
Yes. And then with
because you've
those
seen the
people,
shift.
that's funny that you say that because we call it the shift.
Oh no
Like
way.
at our clinic. Yeah, we always say like, "Oh, like there's the shift." Like I always see, especially with veterans, like they'll come in, like if it not all of them are like this, but if they come in scraggly, like the shift, like they look more pleasant. They all of a sudden wanted to go to the barber shop and get a haircut. It's like they start cleaning up a little bit better, but we see it with civilians too. We call it day 3. Like, because in
Mm,
day 3, like, you start to do that, but to piggyback off what you said, like, some people that is like, "Oh, this is my last resort," kinda thing, and then for us as providers, that's really difficult because you
it
have
is.
to kinda battle through what every other provider has done, and a lot of what we do it's not magic. It takes
Oh, it's
time.
not at all.
It takes effort, and especially with dysautonomia, you have high highs, you have low lows until that system starts to regulate better, and then your heart rate, blood pressure start responding to gravitational input better. But until then, I always say it's like a roller coaster. It's like,
Mm-hmm.
and so it's kinda hard. I find a lot of difficulty with those patients because they've tried so many things that they're gonna have a bad day. I know they're gonna have a bad day
Absolutely.
because they're going to have weather, barometric pressures affect. If they're a female, their menstrual period. If they get sick, that's going to make them have a bad day. And so there's a lot of fear associated. There's always that conversation of like, oh my God, I'm back to like how I used to be, and all these problems are back, and I'm never going to get better. And then you have to kind of go through that initial hump again. So I see that a lot. And it's like, that's a trauma based response.
It's that, and it's what I will say, like the nice thing is because that is very common when it comes in, and I know you show this too, it is like it is validating the journey they've been on, and it is empathizing with where they are, and it is that piece of it already starts to shift after the assessment.
Yeah.
Because we've given them an assessment that they've never experienced before to begin with. We look deeper than any other person they've seen has ever looked before. I'm going to say 9.5 times out of 10. And we're able to speak to them about what we're finding and how that correlates to what they're experiencing in their life in a way they haven't heard before.
Mm-hmm.
So there's already, like, we start to shift that, I feel like, usually in that first appointment. And then, like you said, as we go through the week, for the person that's in that place, and if those of you who are listening that are healing journey, and you're like, don't put words in my mouth, like, again, send me a message with like, and correct me if I'm interpreting this wrong. But like for the person in that place, it's like you're in that place because you've tried so many things and haven't noticed a difference.
Yeah.
And so then when you start noticing these differences on day 3, you're like, holy shit, how is this possible? And it reignites that hope inside you because you're seeing shifts and change in a way that you haven't before. And it's, again, I say to every intensive client, this is not a magic bullet. And the other question is like, am I going to have to come back? I'm like, well, that depends on where we're starting.
Yeah.
As well.
Yeah.
Right.
And that depends on you too. I've had patients that totally, kamikazed and were like, I feel great now, went back to doing things that they weren't supposed to do. And so, of course, you can only drink so much until your brain starts to fry again.
Yeah.
But I also have had a lot of patients that took it to heart, like kept going, and they have kids now because they weren't able to get pregnant. Now they have businesses. They went back to school to get a master's.
Those are my
Two of our
favorite stories.
patients, yeah, two of our patients went back to school to do functional neurology to help other patients. So, there's a little bit of everything when it comes to that. But yeah, like I feel like we ended up at this part of the rabbit hole. We started off with like what has been irritating us from other people. And I think it's really because this is our heart. It's because when it comes to these moments, you don't make money out of holding someone's hand and telling them and reassuring them this will get better. You're just having a bad day. My boss, Dr. Goday, she's wonderful. She's a great human. I really don't drink the Kool-Aid a lot with a lot of people because I know that in the functional neurology world, there's a lot of people that drink Kool-Aid and follow some people like sniff butts. You know what I mean? So,
And here's the blunt spiciness of Michelle coming out.
but you know what I mean? Like,
I know
don't
what you
know.
mean. I know what you mean.
And the same happens in the veteran community too with certain people. They're like, oh my God, this person walked the earth. And I'm like, right. I mean, I only follow Jesus. But she's a great person. She has a great heart. That's why I like working with her. But she says that a lot. She also like really reminds people like this is just one bad day. And a lot of our time is also spent doing rehab, but also almost being like a friend and counselor.
Yeah.
And
People
that's
will they've
why,
tried.
yeah. And yes, crying is almost 100% thing.
Yep.
And, not to make this somber, but with my veteran community and some civilians too, not all, the biggest conversation is suicide.
Yeah.
And so, a lot of the times we were talking the other day with like one of our guys, and he was like, this is not a dog at mental health. Mental health is so important. PTSD is so important. But a lot of the times you often hear, oh, if I'm a vegetable, disconnect me. How many times do you hear that from someone? And what does that relate to? It's lack of function. And so people really underestimate how much traumatic brain injury and the lack there is of quality of life through function and being able to do things for yourself. They're like, oh, if I ever have to wipe my ass and, cut the cord, let me loose. You always hear that from people. And so that's why we talk about these topics because we care about, and we do get spicy because someone's life really depends on it. And it's not cool to see some influencer online trying to sell you a breathing app that's going to solve your life problems when you're on the borderline of suicidal ideation. Like, not cool. And so that I will get spicy for.
I feel like that is the most beautiful place to wrap this episode. We talked about Michelle is stepping into her spiciness. P.S. Your Instagram handle, my dear. Can you say it for people?
It's the brainfluencer because I influence brains.
We will also drop it in the show notes. Give her a follow on Instagram. Reach out, message her. She is the person who is in her DMs, I promise. But I think that's a beautiful place to wrap on. Like, this is a piece of, like, we are all heart in everything we do. And when we get spicy, it's because we feel like there's misinformation, people are getting taken advantage of, or there's just crap happening out there that shouldn't be. So thank you so much for being here. I'm glad we got it to work this time. We were supposed to do a podcast episode around the summit, and Michelle was a brand new mom when we did the summit. So life was a little chaotic. And again, that's every time I'm like, crazy people in the US, like, you guys go back to work after 3 months, which is just like bonkers to me. Canada, we get 12 to 18 months.
What?
Yeah.
Yeah, that's wild. I mean, I get it now that I've been through it. I get it. But yeah, that's bonkers. Yeah.
Thank you for being here. Michelle's going to be back for the summit this year too. We had that chat in September. But to those listening, thank you for being here. And until next week, we will see you then.
Bye.
That's today's episode. Thank you so much for tuning in. If you liked what you heard, give us a like, give us a share, give us a tag on Instagram, and please never hesitate to reach out. We love communicating and connecting with you. Until next week, my friends, have a marvelous day.